Well, in one of the previous videos I posted, I talked about interview questions and a little bit about questions that you should ask your employer. I'll put it here if you haven't watched it yet. These questions that I talked about previously can be asked mostly if you're in an in-person interview. My first interview for an RN position had questions just like that. Now that I have some years of experience, they might not ask many of those questions. In here, I'll be showing you more of an overview of what you should ask. And after COVID, more of the interviews are over the phone, so they might be a little faster. I had 2 interviews recently, and I will tell you exactly how they went and what you shouldn't forget to ask the employer for your benefit. Well, first, prepare something to write so you don't forget to ask these questions. And you can write down the answers really quick during the interview so you don't forget the answers later. And especially if you're comparing to other offers, if you're applying to several positions in other hospitals. Well, both interviews I had were with a talent acquisition professional. My first interview ever was with a nurse manager, but now I see that it's more with this talent acquisition person. So they don't necessarily work at the hospital, but they should know everything. And they do everything as deciding to hire you and your pay. They started the interview talking about the position I applied and about the hospital itself. How old the hospital was, what floors they had, how does the unit I applied for works, how many beds, and a little bit about the patients that they take care of. And here goes the first question you should make sure you ask and know the answer of. What type of patients will I take care mostly on this floor? Is it stroke patients? Is it heart surgeries? For the second question you should ask, one of them talked about it and the other one didn't for the 2 interviews I just had, was the nurse to patient ratio. Then they talked about the bonuses they offer and the benefits they have, such as health insurance. Here, I will already open another question you should ask. If they are offering bonuses, either for sign-on, retention, or relocation, how long is this contract for? And if I break the contract, what and how will I have to pay it back? Here you can say something like, I do not plan to leave this position anytime soon, but I wanted to know what are the complications of breaking this contract. Or something like, I plan on staying for a very long time, but I do have to ask about the contract. If I leave before the 2 years, do I have to give it all back? Something like that. Also, is this a lump sum payout or are they payments throughout the contract? Also, what if I change hospitals in the same system or the FTE status? There's a lot of questions, as you can see, that you have to ask about this contract, and it's very important. Then they asked me during the interview, both interviews, by the way, were over the phone. What was my last position like? What was the nurse to patient ratio? What type of floor was it? How many beds? And what trauma level was it? 1, 2, or 3? Then they confirmed if I wanted a day shift position or a night shift position. I asked about if they didn't talk about the differentials, then here's the time to ask what type of differentials do they offer and how much is it? How much more for night shift, for weekends, for holidays? And then here you can also ask how many holidays you'll have to work and how many weekends is this position required to work. Is it every other weekend or every 3rd weekend? You can also ask about PTO or PDO or vacation days. They should have the numbers. You can ask what are their flexibility with schedules. Are you going to choose the day you work or will you have to follow a certain schedule? They asked what are my total years of healthcare experience and total years as an RN. What is my highest degree? And another question that you can ask is how often will you be able to work overtime? And how often are people put on call? How much do you get paid if you do? During this part of the interview, I also said that I have 4 languages in my background before they talked about salary, so they could put that into consideration. So you can also talk about that during this part of the interview. Okay, so here I am at a website just to show you an average RN salary per state. Here, I think the last column is the best one that we can kind of take a look at. But first here, I want to talk about how do they choose what to pay you. So normally the nurse managers or the talent acquisition person, they will have a Excel sheet where they will add everything that you have on your resume, and that's how they choose your pay. So basically new grads don't receive much. There's not too much wiggle room to ask for a higher pay. But if you were a CNA first, if you were an LPN first, if you had any healthcare experience before you graduated, you can totally talk about that and how that could aid you into becoming a nurse. Then you can talk about all the certifications you have. And then I talked about languages too. And then, of course, if you have an associate's degree, a bachelor's degree, are you starting your MSN? Basically, they will increase your pay if you have a lot of years of experience as an RN. You can talk about if you had previous experiences in other units also. So I made a little math. So about $70,000 is about $34-$35 an hour at least. Two more things you can ask if you want to. What are their nurse retention rate and the potential for advancement of career if that interests you? And you can ask too, how many weeks will you have of shadowing, precepting, or training before you're on your own? And here's something that I forgot to ask and I wrote it down so I don't forget it next time. What is the computer system they use? Is it Epic? Is it Cerner? Next, they talked about the start date, or when was I ready to start? And then now, the most important, the pay. After all the talk and questions, they should ask you what are your pay expectations. My tip is normally on their website, they should have the pay range. Here you can say something like, is there anything I can do to be qualified for the max pay range, which on your website was $40. If they say, well, you have to have a bachelor's and 15 years of experience, well, you can say something in the middle there for your expected range. Then they should give you a pay rate per hour. And always, always, always say that you were expecting a little bit more. They might have a 3 to 5% increase when you say that. When you're done with the conversation with the interview, if you're not sure that you want to accept the offer, you can say something like, I still have a couple of interviews scheduled. When can I give you an answer? Well, these are my biggest tips for the interviews. Like I said, I just did 2 phone interviews and they went exactly like this video. And if you have any other tips for other people that watch this video, please leave them in the comments. I am sure it will help someone. Other than that, I hope you get the job you choose and good luck.